Chapter 13. Can St Johns Wort truly help your anxiety and depression? Here's my short review on this yellow-flowered plant known as St Johns Wort, and the pros and cons when it comes to trying to use it against depression and anxiety. I've had mixed feelings on the effectiveness of this herb, and want to lay it all out for people because there seems to be much confusion in the never-ending search for herbs that will help with depression and anxiety. So how does it actually work? St. Johns Wort contains important compounds in it that have medicinal qualities such as hypericin, which is believed to have a similar effect to antidepressants. It affects the level of serotonin, dopamine, and norepinephrine, which make up the neurotransmitters in your brain. In my experience, it was most effective during my mild to moderate days of depression. In extreme cases of depression, the herb was not very effective for me at all. But that doesn't mean it won't work for you. Mike, who is a very good friend of mine, tells me that this herb has been a small miracle for him when it comes to his sleeping disorder, the release of tension in his body, and his concentration levels. There are also studies that would definitely support his claims of the effectiveness in these areas. In ancient times, many herbalists as well as doctors used this herb as a sedative as well as treatment for malaria, and in my experiments with it, I can say that it is put to great use when I had a burn or an insect bite as well. St. Johns Wort affects the nervous system as well as does a great job for the digestive system. The antiviral properties are utilized to strengthen our immune systems and also has been known to be very effective against colds and flus. But could it just be a placebo? I truly believe that if you're suffering from the mild to moderate range in terms of anxiety and depression and are wondering which herbs would be helpful and would rather take the natural route instead of antidepressants, then you should give St. Johns Wort a shot. In my experience, there has been times where it has kicked in and I've felt the effects suddenly, and other times I've taken it for long periods of time with no effects whatsoever. But I will tell you this, when it comes to side effects, this herb beats antidepressants by a long shot, and I've experienced substantially fewer side effects through this natural herb. Of course, most doctors will tell you not to waste your time with experimenting with this herb when it comes to anxiety and depression. But I say give it a shot. It may be the natural alternative that you may be looking for. Would I ever take it again? Definitely. Due to the effects St. Johns Wort has had on my mild to moderate depressive symptoms in the past, there is no doubt this would be my first choice for this solution. For depression, the standard dose of 300 milligrams 3 times a day worked well. But keep an eye out if it starts to bother your stomach, and I definitely don't suggest taking 500 milligrams twice a day or 600 milligrams once a day. Spread it out in small doses and remember to take it with food. How long did it take before I noticed any changes? In my experience using this herb against depression, it took about 4 to 4.5 weeks for St. Johns Wort to really start kicking in. But again, everyone is different and it's not uncommon to hear changes in mood and depressive symptoms in 2 to 4 weeks after taking the suggested dose. What do some studies show on the effectiveness against anxiety? Researchers have used a dose of 600 milligrams per day for a duration of 6 weeks on 151 people with sleep-related problems. There was a significant reduction in anxiety seen in this St. Johns Wort treated group. Also, 500 clinically depressed patients with high levels of anxiety were tested by researchers using 500 milligrams of valerian and 600 milligrams a day of St. Johns Wort. This is a good combo. The group reported significant decreases in anxiety, and when in fact upping the dose and retesting had reported even better results. When should you not take St. Johns Wort? If you are currently on an antidepressant, especially an SSRI such as Prozac for example, it is recommended you stay away from St. Johns Wort. These types of interactions could result into what is called serotonin syndrome or serotonin toxicity, which is an excess in serotonin activity. Also, if you're pregnant or under the age of 12, stay away. Or have substance abuse problems, or are dealing with addictions to alcohol or other drugs. Then, taking St. Johns Wort could cause severe drug interactions. The conclusion. Although there are still many studies being conducted to evaluate the true effectiveness of St. Johns Wort, I can truly say that I experienced better benefits from this herb than I did for antidepressants. Why? I'm really not sure. Maybe it was the idea that I was taking something natural and didn't have the fear and confusion of taking something artificial and chemically that was doing who knows what to my body. I also thought it would be worthy to mention that I use this herb in tea form as well as pill form. Not sure which was better, but again, try them both and see. In conclusion, St. Johns Wort gets 2 thumbs up from me when used for mild to moderate depression and anxiety.